Foxy 107, 104, and
I'm Melissa Wade from the Light 103.9, and we have some wonderful things to talk about today. We know that as parents and just in general, we have plenty of questions when it comes to the COVID-19 vaccines, Karen.
Yeah, we do have a lot of questions, and it's the vaccines. It seems like it's all we hear about now. And it feels like, when you look at the news, everybody's vaccinated, everybody's getting the vaccine, but that's not true. And we recognize that a lot of our listeners still have questions, still have concerns. And we've put together a great team of doctors from Duke today and individuals who work at Duke that can answer the questions that you have, the questions that you were afraid to ask, maybe even answer the questions you didn't know you have. Absolutely. So, Melissa, we want to make sure that our listeners are taken care of and they know what's going on, right?
That's what it's all about. It's our virtual town hall. So welcome, everybody. Let's get started.
All right. So let's jump right into it because we want to address the questions that our listeners have. And number one is a big one. I think it's not just our listeners, it's people all over the country want to know, how do I know that the vaccine is safe?
It's a great question, Karen. And of course, it's one that everyone has. How do we know? And I believe the vaccine is safe based on the information that I've read and I've seen. And with me working in healthcare, I actually have attended many sessions by different clinicians that have provided a lot of information. And I've had the opportunity to read some of the studies. But based on where we are right now, I do believe it's safe and recommend the vaccine.
Okay. So next question, I think that this is a big one. What should I tell my loved one if I'm vaccinated, but they don't want to get the vaccine and I want to help empower them to get past their hesitation?
Absolutely. We are trying so hard. And I've been in that space and I remain in that space as I talk with family and friends every day about the importance of vaccine. And there's a lot of, we call it hesitancy, but people are just unsure. And they're unsure for a number of reasons. But right now, I urge them that this last year and a half has been really hard. And it's been hard to be separated from family. There's been so much isolation, and particularly for the elderly community. So it's time for us to get back together again and to do it and feel safe. We want to be able to protect all of our family members, especially the elderly, and be able to hug them and see them and just enjoy the closeness that we've missed so much.
I agree. I miss a lot of my family and friends and even some of my coworkers. I'm ready Absolutely. To get back to work and hang out with them and be silly again. So what has Duke Health done to make its vaccine distribution more easily accessible to everyone, including communities of color?
Duke has worked really hard, and I've been on the vaccine committee and a vaccine equity committee to assure that we're working hard to make vaccine accessible for everyone. And we started following the priority by the state and the country, initially looking at healthcare workers as the first level group that was high risk, but also identifying all of the other levels as we've gotten to the community. There have been, big partnerships with community leaders, primarily many of the faith leaders, and we've tried hard to partner with people in the community that particularly people of color trust and believe, and in places where they trust and they feel comfortable. So we've had so many clinics that have been coordinated as pop-ups in many churches, in the credit union, in the Latino community, across Durham. There's Wheels, which is the everyday clinic that's in partnership with Public Health Department. And, that was strategically located. So, the Wheels site, that was chosen. It's away from Duke Hospital. It's away from our clinics, but it's in the community where people are used to feeling comfortable. And we want to meet people where they are and make the vaccine accessible. In addition to that, there's also a lot of going on to immunize those that are homebound, those that are homeless, et cetera, really immunizing people where they are to give them that safety.
Great. Now, this is another big question. Why should communities of color trust the vaccine, given the historic wrongs that have been committed against our community?
Well, that's a theme that affects so many of us. And there have been a lot of concerns about experimental therapy over the years that people were entered in unknowingly. And so there's a lot of mistrust from bad effects from some of those things. This is a vaccine that really is promoting public health for everyone. And as I said, it started with healthcare workers. So this isn't targeting one particular group. This isn't experimental at all. This is really considered, vaccine is something we've been used to doing for infectious diseases for a very long time. So, again, not targeting those groups, but we want to make sure that it's accessible to everyone. But there's not one group that's pointed out that they're only targeting. There's no bad effect targeted to any particular group. So again, this is open for everyone, but our focus has really been to ensure there's equity and accessibility in providing this vaccine.
So if people want to get more information, they're unsure, they've read multiple things online, they're not really clear on what they should believe and what they shouldn't believe, where can they go to do their own homework? What trusted sources can they check out?
So this is really important, is to ensure that you're getting access to the right information. And there's a lot of information. Obviously, sometimes there are myths and things that are just not true. There's a lot of really good information. And I'd say, number one, you want to have that discussion with your healthcare provider. If you have a primary care attending, a healthcare provider that's managed your care that you trust, that's the initial place to start, because that's someone that you already know and you trust them with your health overall. In addition to that, there are many of these clinics that have occurred in community areas with faith-based groups and other organizations. There's a wealth of information also on the CDC site, and CDC has a lot of COVID vaccination information, and that's the country's public health source. And I refer people to that site a lot, and I go to it myself. It provides information in so many ways for every background, for every environment, for healthcare, for childcare, for schools, for work, etc. So I just think that's really a good source of information. And in addition to that, Duke has a lot of information on our Duke site. We have a lot of information for vaccines, talking about COVID, etc. And we also reference the CDC site as well.
Okay. Well, great. That is great information. Thank you, Mary, for joining us today to share that information with our listeners and our communities. Now we're going to join Melissa Wade from the Light 103.
Thank you so very much, Karen Clark. Hanging out with me right now is Dr. Kalu. She's a pediatric infectious disease specialist, and that speaks a whole lot. So pretty much, we're talking about the kids now and how these vaccines will help improve, or, I guess the pros and cons when it comes to this COVID-19 vaccines for them. So Dr. Kalu, welcome, and thank you so very much for hanging out with us today.
Thank you so much for having me. I love listening to your show, so I'm excited to be here.
Oh, that just made me happy. Did y'all see the smile come on my face? Thank you. So, this is a very important topic, especially when it comes down to our babies. When it comes down to our kids, that's when we get serious. Things can attack us or affect us, and we're like, hey, we'll get through it. But when it comes to our babies, that's when it becomes very, very serious. And we know with this vaccine, there are all sorts of people encouraging you to get it, incentives, even, win $1 million, the president, the whole nine. We're pretty much pushing these vaccines. So tell us what COVID vaccine options are available for our children right now, and what age groups are eligible for what brands and why?
Yeah, so focusing mainly on children, which we'll define as less than 18. So I know that children can be of all ages, but right now, for the purpose of the vaccine, we're talking about those that are less than 18. The mRNA vaccines, and specifically today, as we're having this conversation, the Pfizer vaccine is what's been authorized and is available in pharmacies, some doctors' offices, health hospitals as well, health departments as well, for children less than 18. The Moderna vaccine has also submitted for authorization. And as we have other vaccines on the market that are approved or authorized for adults, we expect that they would have pediatric or children-centered trials that will also be reviewed. So I expect that as these vaccines are approved for adults, we'll see them approved for kids. But right now, you can get the Pfizer vaccine in North Carolina and across the wherever you might be for kids less than 18.
Now, I've heard that the Pfizer is available, and as you mentioned, pretty much is that the only one that's available for the children or the younger ones now?
Yes, so Moderna is also authorized. Moderna has also applied for authorization. It's also an mRNA vaccine, and I foresee that both may be available for kids soon. But today, you can get the Pfizer vaccine for kids less than 18.
Okay. Now you say less than 18. How young does that go? Now, are there, does it go? I know I heard something or read like 12, between 12 and 18. Why isn't it available for those younger than 12?
Yes, thank you for mentioning that. I should clarify. So it's not all kids, not down to babies. It's been authorized for kids that are between the ages of 12 and up to 18, and of course adults can get it as well. And
Right.
the reason for this is that as we get younger, so as we start to think about younger kids, the way the immune system works is it's different enough from adults that we can't just take the exact same dose and move it to kids. We have to do some extra testing to make sure that we're adjusting for smaller sizes. And that's what's currently going on. They're doing safe clinical trials to ensure that if we're using the vaccine, we've adjusted the dose down to the amount that should work in the younger kids. And usually we say, for example, we could do like a half dose or quarter dose, but it will mount the same protection because kids can generate the same amount of antibodies even with smaller doses. So the trials only went down to age 12. So we have to wait for the additional trials that are in kids less than age 12 before we give them the vaccines.
Are they conducting those trials as of right now for those younger kids?
Absolutely. Yes, that's ongoing. And it's not just for Pfizer. It's going on for Moderna as well.
Oh, fantastic. So, a major concern when it came to vaccines, especially for the African American community, is it safe for us? Diversified, because we have concerns of things that have happened in the past. As we talk about our kids, we have that same concerns. What would you say, the safety is for kids of color with the Pfizer vaccinations?
So I'll say a few different things. I think the first thing is that's a great question. It's one that should be asked and can be answered by your trusted medical provider. And some of the ways to answer that is by reviewing what did they actually find in these trials and who was part of the trial. It's been helpful that in recent years, the people that are part of trials, the people that are volunteering to participate in a clinical trial, cut across different racial groups and age groups. And so, yes, they did have children from Black, Hispanic backgrounds participate in the trial. And our systems, so after we go past skin, our systems work in fairly similar fashions, and they found the same results. The vaccine works in kids of every race, ethnicity, and can mount the same protection. But that's not the only thing. I think the fact that this disease has impacted our communities so much means we have to stay ahead of every solution. We can question it, we can think through it, we can make sure it's right for us. The vaccines are one of those solutions that are right for us and we needed to ensure that we're staying ahead of solutions so we don't get as impacted as we were in 2020.
Now, concerns such as, and as I say, this can attack us as parents, but when it comes to our kids, there's so many different questions. What about the impact of a child's fertility? What might happen down the line? I think is a concern for a lot of parents, as well as the young adults who don't want to get it as well. What would you say to that?
Yeah, I think, again, young adults and even parents, as you're thinking through this, should certainly continue to have those conversations. There is no evidence to support that this vaccine, everything that's in it, can potentially move into any part of our bodies that would affect reproductive health. But I should also state, we've been dealing with this for about a year and a half, definitely too long, but we're still learning a lot about both the disease process and some things related to side effects from the vaccines. The part that might be helpful is we've had historical knowledge about vaccines. We've been using vaccines for decades. And so we know that if you expect to see something related to a vaccine, it usually occurs in the first couple of weeks after you rolled it out. I got my vaccine in December of 2020. I know if a lot of healthcare providers, I got it really early. So we've now had this at least half a year to watch a lot of people. And we've seen some things, we can talk through some of those, but each month we're getting more and more reassured that there is no concern for reproductive health and some of the other things that have floated around. There are true concerns about some of the things which they've addressed, like the inflammation of the heart, myocarditis, or some of the clots that we addressed with Johnson & Johnson.
Gotcha. Yeah, exactly. I'm glad you mentioned that. Now, of course, for those of us like myself, we'll say, that have gotten our vaccines, we notice, especially in us as adults, maybe some of the slight side effects, sore arm, things like that. Are there any side effects with the Pfizer as far as the kids are concerned that maybe we need to know about? And how does it compare to actually having COVID or them having COVID?
Yeah, so there are two major side effects I'll highlight. Some of the others are things that happen in adults. So the kids, yes, some kids will get fever. Some kids may get sore arm. Some kids, depends on their skin tone, may get slight color change. So like a redness or purple hue or something. That should go away in a day or so. The two major ones to pay attention to, the first one is what has now been included as a warning with the mRNA vaccines. I'll focus again on Pfizer, so the Pfizer vaccines. And that warning is about heart inflammation. And the pattern of events they've realized is since we've vaccinated younger kids, we've vaccinated millions. They found about 300 cases that they're investigating closer, and a few less than those that suggested that something is happening in the week to 2 amongst mostly males that are less than 30. It's unclear why this is being triggered. Thankfully, everyone has done well. So they get some chest pain, maybe fever. So that's the other symptom too that I was going to highlight. If someone's having chest pain, plus a fever, I think that's those two things. So myocarditis, the inflammation of the heart, chest pain after a vaccine. Those are two things to really pay attention to and get a child or a young adult actually also quickly back into the hospital. But I want to point out, and I know this always raises concerns if you hear about anything that's new related to a vaccine. I want to point out this is an extremely rare side effect in the context of known really bad side effects that happen when you actually get COVID-19, the disease. So the vaccine may have a couple tens or hundreds of people. Every one of them matters, but few people that have some very rare side effects. When COVID hits kids, we've been grateful to see that kids can have really mild or have no symptoms at all, which is good. But some of them get that multi-system inflammatory syndrome in children, or MISC, that can wipe them out in terms of just having inflammation everywhere else. And so it's always a balance. It's realizing that the vaccine is safe and it works. Certainly thinking through what's the age of my child. I want to talk to my provider to make sure nothing happens and watch them closely right after the vaccine. But I think we should still do all we can to prevent it, particularly as they're going back to summer camp and schools and basketball camp and life as usual.
Well, I know you all probably get bombarded with this question, but I have to ask. A lot of people are saying, so, as you mentioned, the children are at a lower risk of developing COVID-19 than the adults. So why should they get vaccinated? Why is it so important? Why is it such a push to get my child vaccinated when he or she may not have very big symptoms, so to speak?
Yeah, that's a conversation we probably could have for days because I think people can have different reasons why they're a little bit hesitant. I'm glad to see that kids have not been as impacted by COVID-19, but some of them have been. We have had kids in the hospital. We've had kids die from this disease. But the other thing, we do know that kids can still spread this infection. And kids do not live in a bubble. They are surrounded by people that love them and come in really close contact with them because they are kids. And so we don't want to create a community where we still have a large group that remains unprotected or unvaccinated. And we may not even know they're infected because they don't really have a lot of symptoms, but they can spread it to others who may be older or may not be able to get vaccine, maybe because they have cancer or something else. Some people with cancer can get the vaccine, but maybe not everyone.
Gotcha.
As we see those variants, I'm not trying to raise anyone's anxiety. The vaccines cover the variants, but as we see those variants come through, we certainly want to make sure we've covered every possible group so this virus is not still spreading. So that's why I would encourage people, even with young kids who may only have mild infections, to still get their vaccine.
To mention that, we know that, and seen in the news, children do get COVID. And my question to you is, if they test positive, can they develop major complications? And if so, what are some of the major ones that you're seeing?
So when they initially test positive with COVID-19, so with the acute disease, they can have lung infection. So it's a lung infection. They can be coughing, have a lot of fevers, and come into the hospital for support. So they may need a ventilator, or they may even get the heart inflammation that we're talking about. They may get slight heart inflammation or inflammation of other organs. Mm-hmm. Some of those that have nothing happen to them with the initial infection can get post inflammation syndrome. And so 2 or 3 weeks after they got COVID, they're in the hospital with just head to toe inflammation. So not just getting the initial infection, the issue with COVID is it can do damage to the body where even after the virus is gone or has done its thing, it can still lead to a lot of issues just in general. So both things are concerning for kids.
All right. Well, Dr. Kalu, great information. Now we say, hey, look, I want to get my child vaccinated. Where can parents take their children to get the Pfizer vaccine?
Yes, I know it's been a lot of information, so definitely talk to your provider. You can get the vaccine in any major pharmacy, so CVS, Walgreens, I'm not trying to promote anyone in particular, any health department. You can get it at all the major health systems in our state. You can get it at UNC Duke if you're here locally, and in some of your providers' offices. So call your pediatrician. At this point, we do have some clinics that have it available. And also just look for those signs. You see all the signs around now that say COVID-19 vaccine available.
Sounds great. Final question, it's going to kind of take everything that we've said and that you've given us. Ultimately, what would you say to parents? Why should parents get their kids vaccinated for COVID-19?
I think we all want to get back to some kind of normal. We've redefined normal. And I think in particular, we have to prioritize kids this time around. I think 2020, we may have left kids behind a little bit because they were not as impacted. We had a lot of other groups to focus on, but kids need to get back for their mental health, for their physical health, for just their overall health. Get them vaccinated so they can be out and about like the rest of us, and they can also help us protect the vulnerable people in our population. We can all do this together.
Yes, we can. I say that again. Yes, we can. Dr. Kalu, thank you so very much to you and to Duke Health for providing such great information for our listeners and our viewers today during this virtual town hall. Right now, we're going to go back to Karen Clark with more information about the COVID-19 vaccines. Thank you.
Okay, now we are going to chat with Dr. Saunders. Thank you, Dr. Saunders, for joining us to answer all of our COVID-19 questions. And I know that people have a lot of them. This is a big one. I've heard this a lot. Some people say the vaccines that were developed to fight COVID-19 were developed too quickly. Can you talk a little bit about the science and if this was new science or previous science? Basically, is this all new science that someone created just for this vaccine, or were you all able to piggyback off of things you already knew?
So that's a great question. And I think it's one where there's a lot of misconceptions about how the vaccine came about so quickly. So the way that the vaccine came about so quickly was that there was already a plan in place to respond to potential pandemic viruses. And so that meant that there were already partnerships in place. There was already technology in place that we knew could be used rapidly. And so for a vaccine like mRNA vaccine that would come from Pfizer or comes from Moderna, those platforms were platforms that had already been used in the past. And they were being investigated for influenza vaccines, as well as here at our institute, we were investigating them for as a HIV vaccine. And so those were technologies that were already there, already present. And so what you had to do was just take out the HIV part or the influenza part and put in the coronavirus part. And since people had studied SARS-CoV-1 and they had studied MERS coronavirus, they knew how to design that vaccine. So as soon as the sequence for SARS-CoV-2 became available, all you had to do was swap out the pieces for the viruses that you had been using and put in SARS-CoV-2. And so that allowed the vaccine to move forward a lot faster than it would traditionally have moved forward. Now, mRNA vaccines also accelerate the rate at which you can make the vaccine, because that technology can be manufactured a lot faster than some of the more traditional vaccines. And so the technology that we're using is not something that's new. It's something that has been around for a while. We know how to use it. And so when the virus came about, we were able to just jump in and start using that platform.
That is really good information, because I think a lot of people assume vaccines are supposed to take years or decades to develop. And then when this one is like months later, like, we got one, folks were like, nah, I don't believe.
So it's understandable, because typically it does take a long time to do it. But you have to understand that this was during a pandemic. And so the government had mobilized forces, they had mobilized funding. Operation Warp Speed was put into place to make sure that it didn't take years to come up with the vaccine. And so when you have all of these people working together to move things forward quickly, then you can come up with the vaccine, relatively shortly after it's been discovered.
Okay, I understand that. Now, when it comes to the science, do they take color into consideration?
So when you say color, you mean like ethnicity and race?
Ethnicity and race, yes.
And so when you enroll for a study to test whether or not the vaccine works, your goal is always to get a mixed population of people so that you can understand how well it works in different demographics. Now, with that said, what typically happens is it's usually middle-aged individuals from a single ethnicity that typically enroll into the vaccine trials. And so that's not on purpose, it's not intentional, but that's typically who enrolls into these types of trials. For the coronavirus vaccine, this was something that was really thought about. And so there was a concerted effort to really try to get people of many different backgrounds, of many different ages, into these types of trials to make sure that the vaccine worked in all different demographics. And so I do know that there was, if you looked on social media, there were people saying, I'm enrolling in these trials because I want to make sure that it works in populations that are typically not in these trials. There were younger folks that were saying, I want to make sure that I'm in these trials to make sure that it works. And then there were people of color who said, I want to make sure I'm in the trials to make sure that it works. So I think we tried for coronavirus vaccine design and development and evaluation to try to be as broad as possible when these vaccines were tested.
Let's jump into variants, because the variants are all in the news now. And there's a lot of concern specifically with this Delta variant. And we've all seen the video from India in the past couple of months where, they're talking about people are selling oxygen on the black market, and there's so many deaths in India, and the virus was just ravaging the population there. Is that the variant that we are starting to see here in the United States? And how does that work into everything? Can you explain what the variant is first, and explain if we need to be concerned about it?
Sure. So the variants of concern, as they've been termed, of which Delta is one, they're definitely something that we have to look at to understand how the vaccine works against them. And so there were two viruses that were somewhat related that really came from that large outbreak that occurred within India. And so the Delta variant is one that a lot of people have focused on, as well as the Kappa variant. And they're related viruses. Their sequences are fairly similar. And so the Delta virus seems to be the one that's really taken hold and is really starting to spread. And so that's the one that seems to be the most prevalent. So what people have done now is actually started to take samples from individuals that have been vaccinated and test whether or not they still have immunity against that virus. And so what we know is that the vaccines that have been administered to humans do provide some immunity against these variants, so in particular the Delta variant. The reason the Delta variant has really risen to the top and a lot of people are focused on it is the fact that it's been so widespread. It's really spreading in the UK. It started to spread across the United States as well. And so what it looks like is that that's going to become the predominant form of SARS-CoV-2 that is circulating. And so we want to make sure that the vaccines are efficacious against that variant. And at least right now, if you look at the data for the Pfizer vaccine or the BioNTech vaccine, it looks like as long as you've been immunized twice, you have neutralizing antibodies against that variant. And we would expect that you would be protected against that variant should you come in contact with it. And so I think there's, the idea why it's scary is because it's starting to spread so widely. But I think, again, if you've been vaccinated and you've been vaccinated according to the schedule that's recommended, you'll have some immunity against it, and likely you would be protected against it.
So do we need to be concerned? I know I was reading about the Delta variant and the outbreak in Israel, and they were saying that half of the people that tested positive for the Delta variant had been vaccinated, but that doesn't mean that they were testing positive and on ventilators and in hospitals, correct?
Right. So one of the things to try to explain also is that a lot of times how vaccines work is that they don't provide sterilizing immunity. So what sterilizing immunity means that they generate an immune response that should you come in contact with the virus never replicates, you never see it infected cell, there's no detectable virus within the person. What typically happens is you have a level of immunity that protects you. And what that does is it protects you from getting sick. That way, if you do come in contact with the virus may replicate and make more of itself inside of you, but your immune system kicks in, wipes out the virus. You never even get symptoms. You never even know that you were ever sick. You never even know that you were infected. And so that's called a subclinical infection, meaning you never get clinical symptoms of the infection. And so that's how most vaccines work, is they kick in and they wipe out the virus. And so if you've been vaccinated and you come in contact with the virus, you may be able to detect that you actually have virus replicating. But what's key is that you don't feel symptoms, you don't get sick, you don't end up in the hospital, and you don't have a high chance of actually succumbing to the disease. And so that's really what the vaccine is there to do, is not to protect you from ever getting infected, but to actually protect you from really getting sick and really having a poor outcome.
Similar to the flu vaccine, because, people take the flu vaccine, they get the flu, but they don't end up sick. They might feel a little sniffle or something, but it's not like put you on your back out of work for a week sick. Right.
And so there's typically, 40 to 50,000 people who will actually pass away from influenza infection each year. Mm-hmm. And so the vaccine really is there to try to keep you from actually succumbing to influenza infection. And so if it can reduce the number of days that you feel sick, if it can reduce the number of days that you have symptoms, then the vaccine has done what it set out to do. And so the same thing with the coronavirus vaccine is it's really there not to prevent you from ever getting infected, but is to prevent you from getting sick and to prevent you from actually dying from the disease.
So, Dr. Saunders, there were definitely some things that I wanted to talk to you about today, some specific questions I had, but I'm going to go off of my script because you're giving such good information. I want to touch on something that I know affects a lot of our listeners. What about the kids? So with school restarting soon and kids are essentially under the age of 12, the little ones are unvaccinated. And then we've got this Delta variant spreading. Do parents need to be concerned? Do we need to pause? I mean, what are you thinking about all of that?
So that's a big question.
I know. I'm putting you on the spot right now.
You're putting me on the spot with that one. And it's always a difficult topic because you are dealing with an unvaccinated group of individuals. Mm-hmm. So I can tell you my point of view of it may not be the point of view that's widely held.
Okay.
And so I'll say that my main focus is actually making vaccines and not so much in the public health space.
Right.
And so you may get different answers if you ask different public health officials. So my understanding of it, a lot of the states are still putting in place precautions to try to keep children safe because they know that children are not vaccinated. There are ongoing studies, vaccine trials to try to vaccinate younger children, going down to a year or half a year of age. And so there are some trials going on that hopefully we'll have some data from soon to tell us whether or not the mRNA vaccines would be safe to administer to some of the younger, like elementary school age kids. But before that study, before those results are available, I think right now still the social distancing and the precautions that have been in place, like wearing a mask, are still the best ways to protect those children. And so from my point of view, I think if your children are in those types of environments, they're in person at school, still having some of those social precautions in place to try to prevent infection, I think is still key.
Okay. So tell us how you know all of this. What do you do with your day every day?
So my lab, basically what I do is I run a research lab that makes vaccines. And so we physically make the vaccine within our group. We test different concepts. And so we work both on vaccine design on a day-to-day basis. We then have a team of individuals within the lab that make the vaccines. We then test them to see which ones are efficacious and which ones are not. And then when we find really cool vaccine concepts that are working, we then partner with our manufacturing team to actually make it as a clinical product. And so we're basically the discovery phase of vaccine development. And mostly we focus on SARS coronavirus 2 and HIV vaccines at the moment.
Wow. It sounds like you have a pretty amazing job. Thank you for all that you do. And thank you for answering these questions. I think you did a really good job of explaining the science and helping us understand how it all works.
Thank you so very much, Karen. Again, we are here answering all of your questions about COVID-19, the vaccines, and, as I say, from the beginning to the end, and we have some wonderful Duke Health professionals who are answering these questions for you. It's our virtual town hall, our COVID-19 participation. And today, Dr. Adia Ross is joining us with some wonderful information. I mean, getting down to actually, treating the patient. So Dr. Ross, welcome. And thank you for being with us today. So look, tell us, what role did you play at the hospital during COVID-19? What things have you seen, and what were some of the toughest memories that kind of stuck with you, giving hope to other people?
Yeah, so thank you again for allowing me to participate. I'm the Chief Medical Officer at Duke Regional Hospital, and I'm also a hospitalist, which means that I take care of patients who are admitted to the hospital. My role was, I wasn't as much on the front lines, as much as helping to make sure that we had the resources that we needed, working with our frontline experts, our infectious disease folks, to make sure we had the right protocols, our ED, our ICU, and our floor doctors and nurses to make sure they had the PPE they needed, as well as making sure that our patients, even in the community, had access to the good research that was coming out, and they had access to the treatments that they had. Some of the memories that were the hardest is honestly, in the beginning days when we really just didn't know, what we were dealing with, and watching patients die and hearing the stories of just how our providers and nurses were doing their best, and it was just so hard on them. But yet it also spurred us to have a lot of innovation. There was a lot of great things that happened. I mean, there were just people really being innovative about how to make sure patients could still communicate with their families, and figuring out how we leverage technology to still provide that same high quality care, even though we had to be in bunny suits. And so it was pretty amazing. And then last, just the partnership with the community. Oh my goodness, like the health departments, the prisons, the dialysis centers, the nursing homes, and us all coming together and saying, hey man, we got to be all on the same page here. Let's make sure everybody has the resources they need. Let's make sure we share information. That was really beautiful. And despite everything that we were going through.
With that said, have you treated anyone in the hospital for COVID-19 who has already been vaccinated?
I have not personally treated anyone with COVID-19 that has been vaccinated. I've definitely treated patients that had COVID-19. It's actually, it is possible that especially if you're in between, if you're getting the Pfizer vaccine or the Moderna and you're in between your two shots, it is possible for you to still get COVID. I want to remind people that the COVID vaccine, our main outcome for that was not necessarily preventing people from getting COVID. I mean, that is something that we want to try to do. The main thing is preventing people from dying and preventing them from getting hospitalized, because those were the main outcomes of the clinical trials to really try to decrease the severity of COVID. Now, there have been, we've actually studied healthcare workers in Israel and also the United States. And so getting COVID is actually pretty rare from, after you get the vaccine, but it is still possible. And I would tell people, if you're in between those vaccines, between your first and your second shot, make sure you're still wearing your mask. And if you get the one shot or you get the 2 shots, it still takes about 14 days after you get your shots and complete the shot series to actually be fully vaccinated. So just reminding people, it is a possibility.
A lot of people think, as soon as I get the shot, I'm good to go. I'm made of steel and I can't get the virus. And even after you get all the vaccinations, you still are subject to getting it. So that's great. Now, during this pandemic, during the height of the pandemic, communities of color were disproportionately affected by COVID-19. We know this. And a number of the cases and a number of the deaths, were pretty much and primarily a lot of the ethnic, community, us here. So why is it important for us to see and to recognize this? And what should that tell us about the health equity that's happening right now?
Yes. Before I go to the question, I just want to make it clear, though, that even though people can still get COVID when they get vaccinated, it is really rare. So I want to make sure that's very clear. And we want, because studies have showed over 90% of people that get the vaccine actually don't get COVID. So, but going back to your question, yeah, I mean, when we look at the total numbers in North Carolina, for example, yes, the total number of cases are higher in whites compared to minority groups. But when you think about the percentages of the population and what percentage of our individual groups actually get it, it's disproportionately high in communities of color and African-American and Latinx communities. And I think what this tells us is just, we know there are existing health inequities and social determinants of health that we're still really working hard as communities and as health partners to work on. And those things show up because, the severity of disease in those populations tends to be higher as you get more cases and, thinking about, people having access to good healthcare, good transportation, the types of jobs they had, which may have put them at risk. And then just, all those other things with, having access to good food and screenings, and they just kind of come together for a perfect storm to make us more likely to get really, really sick. And that's why getting vaccinated is really, really important, because I think that is a leveler. And we know that it works in every type of ethnic group the same. And so that's one way that we can really try to combat, the health inequities, at least starting to level set with our vaccines.
Now, some people that are watching right now might be saying, when you mention health equity, what does that mean and why does it matter?
Yeah, so health equity, the CDC has a very specific definition, but just to paraphrase it, it's just making sure that everybody has access to healthcare in a just and equal opportunity way. I mean, it's just that simple. And, health equity is just a function. It's not just a function of having access to a hospital. It's having access to information. It's understanding, that there's a lot of things before you get to the hospital that affect your ability to actively engage and partner with your providers and your health system and your health. And so, I think we know that we still have opportunities. And I think, what's been beautiful about what we've seen in the community coming together is, shout out to Dr. Mandy Cohen and Governor Cooper and all the health departments, because they really challenged the community health departments and the health systems to say, hey, you're going to get this vaccine sent to you, but you guys are going to have to show us that you're actually distributing it in an ethical and equitable way to the community. And so I think health equity is at the top of mind. I think that the events, that have occurred in the last summer, we've had 2 pandemics going on, and I think we all are heightened. And for those of us in the community of color, we knew about all these things, right? But I think having a voice and having it be more at the forefront has been amazing. And it's also challenged us to continue to do better.
Absolutely. I totally agree. Now, coming to getting the COVID-19 vaccine, how is receiving the vaccine and having fair access to it a part of achieving a better health equity, so to speak? And is this, would you say, a sort of woke thing to receiving the vaccine, and why or why not, do you think?
Yeah, I mean, I think getting a vaccine is, I mean, it's like a leveler. We think about just in general the history of vaccines in this country, and how much it has allowed us by having access to those vaccines compared to other countries to be able to do the things that allow us to achieve, our personal success and those kind of things. So definitely getting the vaccine, I think, is part of health equity, because again, we can't really without partnering together with our education system, public transportation, communities, to really look at health equity in the larger scheme. But what we do know is that if you get vaccinated, that you have upwards of 70 to even 90% chance of not getting COVID, which allows you to still be able to provide food for your family, still be able to have your education uninterrupted. And so I think getting the vaccine is one of the ways that we can level the playing field, at least in this pandemic, around some of the things that are leading to the pandemic to exacerbating our health inequities.
Wonderful. Of course, people of color, our communities have reservations about getting, the vaccines, period, or a vaccine at all because of our past. Now, people talk about balancing discussions of Black trauma with discussions of Black joy, so to speak. We talk about earlier about the higher number of COVID cases and deaths in our community of color, just in general. Can the vaccine kind of be a tool for Black joy, having a window of saying, hey, this is the way we get out? If so, how do you think so?
Yeah, so I think it's really important, Ms. Wade, to just acknowledge that, as communities of color have suffered inequities, historical inequities, and there are many people alive today that can bear witness to those things. And so we have to really honor that and understand that. Tuskegee and Henrietta Lacks and all these things that really you can understand, and people's personal experiences with the healthcare community. But I will say, in this situation, knowing all that, I would say the vaccine and how we are distributing it, how it was tested in communities of color around the world, this is a different situation that we're in. I mean, I've read the FDA documents, and that was one of the reasons I felt very comfortable getting, because I'm like, wow, they really have done a good job on really thinking about and being thoughtful about which communities that are getting this vaccine. And so I think there is a lot of Black joy. I can think of, I'm one of the medical directors of our COVID vaccine clinics at Duke Regional, and I was at a pop-up clinic at a church, a local church. And I remember this man, we have a certain amount of vaccine that we have, but we never want to waste any. So if someone cancels, or was able to get a vaccine somewhere else, we always give it to anyone. We'll go outside and be like, hey, is anybody that wants a vaccine? I remember this one man he came with his friend. He couldn't initially sign up, but we were able to give him a vaccine, and just tears of sheer joy. And I think relief, this African-American young man in his 40s who had a lot of medical conditions. When we think about health inequity, he didn't really have stable housing. He didn't really have adequate transportation. So he was just so worried in combination with his own medical conditions. He just told me, he said, I just knew I was one of those people that's going to die from COVID. Mm-hmm. And to see him just feel so much relief, knowing that he is going to outlive this because he has access to the vaccine, was just, I'm getting goosebumps and a little teary-eyed thinking about just how beautiful that is. And how, we basically injected, joy and hope into him through that. And so it can be very beautiful. This idea that, hey, like he can continue to work on those things to help him be more stable, because he doesn't have to worry about it. He can continue to try to find a job. And even if it is an essential industry, because he knew he was protected. And so I think there is a lot of joy that can come from this. I lost my uncle to COVID, and that was just awful. And I remember getting my own vaccine and feeling this mix of just feeling so blessed, and also having a little bit of, just sadness, just being like, oh my gosh, if it would have been 2 or 3 more weeks, he would have probably been vaccinated, And so I think all of us just need to understand, just how blessed we really are to have access to this vaccine, and to honor those that have lost their life because we weren't in that point where we could give them the vaccine. And so if we have access to it, really honor those by taking the vaccine.
Yeah, I agree. Aside from the reservations that we may have, you all as doctors, the nurses, the health facilitators have worked very hard to make sure that as many people have access. And now we can, pretty much go wherever we want to be able to get a vaccination. And that is joy within itself, knowing and remembering, as you said, how many of our loved ones, especially in the African American community, lost their lives because of what we didn't have back then that we do have right now. So, this part right here, I just want to say thank you. Thank you, Dr. Ross, and to all of the doctors there at Duke Health for all of the hard work that you have done to help us get to this joyful point.
Yeah, when you think about that, I just want to say thank you also to the media, because we couldn't, one of the things I realized is just before this, I knew how important it was for radio and talk and the news, because you guys help us spread the message. We couldn't do this without you, but I did want to give some, when you talk about, thank yous, I do want to give a couple shout outs to my colleagues, because, I'm standing here representing a whole team of people. And so I think it's important for people to know, want to shout out Dr. Sarah Lewis, who was our medical director of hospital epidemiology. She helped us really figure out and take the information and really apply it. Dr. Aparna Kamath, who's our associate chief medical officer, Joy Vollers, who's the head of our infection prevention, our ED director, and Dr. Brian Burrows and Zach Cockerman, our nurse manager, our IC director, Sandy Hawk, and Dr. Mashael Al-Hedlin from the ICU. The hospital is Dr. Megan Brooks, Drs. Lalit Verma and Adam Wachter, who work tirelessly to think about on the floor is how we continue to have a good patient experience. The pharmacists, Dr. Lynn Witt and Dr. Daryl Blackburn, and all the work that they did. I mean, they were there. They were the ones getting our shipments and making sure that we had the right dosages. Our clinic people, Jen Wilkins, Carol Swanson, for just setting up all our clinics and the pop-up clinics everywhere. Michelle McMoon and Amy Mangum for all the things they did to make sure we had enough providers. Our surgeons and our surgical team, Dr. Joe Minshew, Paula Cates, Dr. David Boyd, Dr. Bill Norcross, Dr. Chris Gratian, who made sure that right before surgery, make sure everybody was safe, and then we can continue providing that excellent care to people even during this time. Our communicator, April Dudash. And finally, I'm just going to tell you, our boss, Katie Galbraith, who, the president of the hospital, and was just tirelessly working with the community to make sure that we did what we lived our values. And so I just want to say that, yes, I'm here for Duke Health, but there's a lot of people at Duke Regional that did a lot of wonderful things. And so it's really important to acknowledge them, because, it's been tireless.
Well,
and thank you for allowing me to do that.
Thank you for doing that. My final question, just kind of want to make it personal, if you don't mind. I don't mind sharing that, yes, I'm vaccinated. I did have COVID. I went through it. And as I was going through it, even though my symptoms were fairly mild, Dr. Ross, I remember saying to myself, wow, if I wasn't as healthy or as in shape as I was, I think I would have ended up a lot worse, or going through it a lot worse than I did. And so for the vaccinations or the vaccines to be here is truly just, a wonderful outlook of where we are going. And I just encourage those to get vaccinated. I'm not sure if you mind sharing, are you vaccinated and how your experience was?
Well, first, absolutely. I am vaccinated. I'm so happy to hear, Ms. Wade, that you also are vaccinated. One thing I would say that you brought up a really good point. We think we know how healthy we are, but you don't always know, right? Because a lot of people, we talk about health inequities and people going to the doctor. Unless, if you're in your 40s and you're not getting your regular annual checkups, you may have high blood pressure or other things that may be predisposing you, and you feel fine until you have a major event. So I think sometimes people, without being, unless you're a doctor yourself or in the healthcare field, they may overestimate how healthy they are. If you're a little bit overweight, you may be feeling fine, but, that doesn't mean that your lungs would be able to recover as safely as someone who didn't carry a little extra weight. So I think you're good. You have a really good point that, yes, I'm so happy for you that you recovered, and that it really wasn't that bad for you. But I think none of us really know, how it's going to go, because there have been people that have been relatively healthy that got hospitalized and got very sick, and had long COVID, as we said. That, one of those things that people say where some people, for some reason, have this protracted or long recovery phase. And we're not really sure why some people have it. And some people were actually pretty, I'll say, healthy beforehand. So yes, with me being vaccinated, I will tell you, it was joyous. Again, with me losing my uncle and thinking about those lives lost, I felt so blessed. thought about my colleagues around the world and some of them who are fighting COVID every day and don't have access to this. So I felt very lucky and very blessed to be able to do that. And I think, I haven't actually had COVID. I was lucky enough to not have had it, but I definitely have known people that did. I did have some minor, I would say, side effects. And so really what those were is I had a little pain at my arm where I got the vaccine. I also had a little bit of muscle aches, but they weren't really bad. And actually, I was fine with it because I was like, okay, this is just part and parcel of making sure that I stay safe. And, the vaccine doesn't give you COVID. It's just that as your immune system is getting trained, and depending on your age, sometimes you have a little bit of side effects. And so it doesn't mean that it didn't work if you didn't get those side effects, meaning the fevers or the chills. But it can be indication. And if you've had COVID, you're more likely to have those because your body has been a little bit trained. The antibodies that you get from getting a natural infection, like actually getting COVID, don't last as long as a vaccine. But
Right.
Your body's like, you know what, I've seen this before. And so there's a little bit of pre-training there, but
Thank you for sharing your experience. We really, really do appreciate it.
Thank you so much for the opportunity.
You're welcome. All right.
So Melissa, I think that we have gotten a lot of questions answered today. Matter of fact, I got a lot of questions answered. I thought I had read up on everything, but looks like I needed to do a lot more reading. So I'm glad we had a chance to talk to all of these health professionals from Duke to answer our questions.
Absolutely, Karen. I mean, I'm like you, we covered base for everybody, whether it was yourself or your spouse or your children. We covered with these Duke professionals or healthcare professionals, all the answers to any questions, hopefully, that you had. And so we thank you all so very much for joining us for this wonderful virtual town hall. Karen, I've had a ball.
I have too. And I guess we will talk to you on the radio.
Will do. Until then, grace and peace, everybody.